We have many patients that come to us with missing teeth, broken teeth, having a full mouth of teeth that need to be replaced. Oftentimes people don't even realize the problems they've run into because they've been staggered over the course of their life. Beyond dentures, we have a solution for people that creates a replacement for multiple teeth that have been missing or broken. That would be a full arch solution. That can either be for an upper or lower, involves the placement of multiple implants and then teeth placed on top of those. We have two primary options for people that are struggling with dentures. One is a snap in, snap out, where they would have anywhere between 2 or 4 implants placed under a denture, and it allows them to continue to remove their appliance but have the security and comfort that it's not going to be falling out at inopportune times. Another option is a full fixed option, which tends to be anywhere between 4 to 8 implants depending on the individual needs of the patient. That option is a full fixed option which can only be removed in the office by us at regular cleanings and exams. What implants provide is they save the bone, they prevent it from atrophying or deteriorating away and minimize that sunken look that people end up with over time. Second, it gives people the biting power they need to chew foods. Oftentimes with dentures without implants, they're falling out or people are having trouble keeping them in while eating, and implants provide that stability. A patient's individual needs are varied based on their motivations, goals. Everyone has different set of wants versus needs. There's financial limitations, and we work with all of that. Our goal is to come up with a customized plan for each person. The best way to figure out if this is the right treatment for you is to give us a call, schedule an appointment. We'll be able to assess the quality of your bone, your individual needs, your goals, and we'll be able to come up with a game plan that is right for you.